is special about our aortic program at Boca Regional? There are a lot of things that are special, and really it's the team that we have created. We're doing the same things with the same people nearly every day. So it really is practice makes perfect. All of the other evidence-based things that we're doing are just as important to their recovery: the pain management, the fluid management, the avoidance of transfusions, the care that they're receiving, from the second that they walk into the door to the second that they leave.
Many patients are very anxious regarding undergoing open surgery, especially in terms of the pain of the incision and postoperative recovery and return to their basic lifestyle. In our practice, the decision to offer stenting versus open surgery really hinges upon the person's age, their expected longevity, and health status. People who we feel have at least 5 or more years to live, I believe, are best served with open repair.
Especially in complex cases such as the open aortic surgeries, the type of anesthesia and the quality of anesthesia that's delivered really affects the outcomes of these patients, and it can affect the long-term outcome of the patients.
Time is obviously of the essence because the quicker you can perform these procedures, the less anesthesia and less risk it poses for these patients.
The paravertebral catheter is placed preoperatively under light sedation, and the patients tolerate it very well. They're placed on their right side, and I do it under ultrasound guidance, and I find the correct place, and I thread a tiny catheter in there, which stays for the duration of the patient's hospital stay. And I continuously infuse local anesthetic medication that numbs up the area of the surgery. Postoperatively, again, I run a continuous infusion, and the patients have adequate pain control. What adequate pain control does for these patients is, 1, it allows us to remove the breathing tube much sooner. 2, it decreases the amount of overall opioids that the patients are taking. So without exposure to opioids, the patients are more alert, they're breathing better, they don't have as much ICU delirium, they're not as constipated, they're able to get up and move around much faster, which overall improves the recovery.
To undergo open repair of such a condition as an aortic aneurysm, it is critically important to select your surgeon in a hospital of high volume. These types of surgeries are now rarely performed in many hospitals. This statement has been borne out by a number of prior scientific studies demonstrating the correlation of high volume surgeon and center to good outcomes. At Boca Raton Regional Hospital, we perform annually approximately 90 to 100 aortic aneurysm repairs a year.
By using the enhanced recovery protocol for the open aortic surgeries, the patients gain a lot coming to Boca Regional. So they have a team dedicated to their care. They're leaving the hospital 3 to 7 days sooner than they would have before. They have overall better pain management, less opioid usage, decreased blood transfusion, and overall a very good experience.